Gestational diabetes occurs in about 10 to 12% of our population. Certain women are at risk for it. Having a family history of adult onset diabetes, not juvenile, but adult onset diabetes, the type that's associated with older patients or family members, obesity, overeating, can be a predisposing risk factor. Women who start their pregnancies overweight or gain excessive weight during the pregnancy can be at risk. Women with twins or multiple gestations. But interestingly, 50% of our women who are diabetic during the pregnancy don't have those predisposing risk factors, which is why we screen everyone during the pregnancy, because we would miss 50% of our diabetics if we didn't. So basically what it is it's an inability for women to metabolize the sugar that they eat normally, and it's actually thought to be related to one of the placental hormones called placental lactogen, and women don't really have control over it. Like, a lot of women will come in and say, I know I shouldn't eat a lot of sugar when I'm pregnant, and that's not really true, separate from the fact of how heavy they are. Like, yes, they shouldn't eat a lot of sugar in place of other healthy foods, but if they're otherwise normal weight and gaining appropriately, the sugar in and of itself is not the determining factor. So yes, they should pay attention to their weight, yes, they should pay attention to eating healthy, but again, a lot of women will be gestational diabetics in spite of the fact that they're doing everything correctly. So what we do is we actually screen our population twice. We screen once in the very early second trimester and once in the very early third trimester. Generally speaking, most women will be diabetic in the beginning of the third trimester or after. We do a standard glucose screening test, and if they are, they follow a diet that's low in simple carbohydrates and has more complex carbohydrates, little higher protein, and they're followed by doing finger sticks. They test themselves in the morning and they test themselves after meals, just the way a standard diabetic would, and they follow a diet. It's very rare for them to need insulin or oral medication during the pregnancy. Most of them do really, really well on diet, and it almost always resolves after the pregnancy is over. It's more common in teens, it's more common in older women as well, for reasons that aren't completely clear. But again, following a diet will almost always get the sugars in control. They should be aware that women who have it in pregnancy are at increased risk for developing it in later life, so those women are watched by their internist or by us a little more carefully. But again, almost always will resolve once the pregnancy is over and the baby and the placenta are passed. And we just follow them up with, at their 6-week visit, we do some testing to make sure that it has resolved. But again, it's usually a very easily managed thing. The babies of gestational diabetics generally are a little bigger, even with good control, so we do keep an eye on them, but otherwise the pregnancies generally are uncomplicated and the babies are healthy.